Pre-Spinal Fusion Surgery. Instagram post on October 8th, 2024. Drawings, writing, and post by Sierra C.J. Morris. At Zukibi123 on Instagram. Frankenspine. My upcoming surgery info, having scoliosis and spinal fusion. I always had general back pain and was pretty short, 5'3", but it wasn't thought I had scoliosis until I was in the hospital for a separate reason. Scoliosis can be defined as an unnatural curve of the spine. In my example, I was diagnosed at 14 with 2 greater than 60-degree curves. Yes, it's painful and qualified as severe in my case. And here is an example of my actual x-ray of what my spine looked like. I mean, right now I'm recording this post-surgery, but I made this comic pre-surgery, so here was my current back at the time I wrote this. It's hard to tell if you aren't looking for it, but my shoulders and hips are uneven. I lean more to my left side, and each side feels very different and uneven. And this drawing is obviously an exaggeration, but that is definitely how it felt. There is an obvious difference in each of my sides. With my level of severity, if I were to leave my spine how it is, I was told it would get about a degree worse every year, and potentially begin to affect my organs and bones, plus I would have increased pain. So the solution to this is spinal fusion surgery. A spinal fusion is a surgical procedure where the spine is straightened and metal rods, screws, and bone grafting are implanted and fused to the spine to keep the spines permanently straight. And then on the next slide is an X-ray example from Google of what this looks like. So here is an example, because I'm so funny. And in my case, I was fused from T4 to L3, which you can see on the diagram right there. So some pros of getting the surgery. I am about an inch taller. There will be less long-term complications, less pain, but that's not guaranteed. And I'm in a perfect time and place to do it right now. There are also really good success rates and professionals where I am. And then some of the cons. It was a difficult recovery at first. I am less flexible, and full recovery takes about 6 months, which is a long time. It's a really invasive, painful, and changing general body proportions type of surgery, and the surgery itself is scary. There is a slight chance of paralyzation, but very, very unlikely. So some general information. The first part it says about a 4-hour surgery. I actually got that wrong. It's a 4 to 7 hour surgery, and my surgery took 7 hours, but technically 8 because that was when I was fully done. So in the hospital for 2 to 4 days after. General everyday movements are fine. Complete fusion and healing takes about 6 months, and that means I can't get any tattoos for 6 months, which was my biggest grievance personally. But it also goes for sports and any major physical activity. Here are some examples of me coping with and processing this surgery through little comics and drawings and jokes. It was on my mind for a long time, and I was kind of telling my followers on Instagram that I was going to keep posting about it for a while because it was on my mind a lot. Although I'm confident it'll all go well and I'll be fine, I'd be lying if I said I wasn't still terrified. I've never had surgery before, let alone something this invasive and permanent. It's scary, man. And it was definitely scary going into it, and recovery was hard. But I can confidently say, recording this now 6 weeks after surgery, that it does get easier, and it does get better, and this was one of the best things I've ever done. So yeah, it's gonna suck, but on the bright side, I'll have metal rods, screws, and a cadaver's bones in me over and around Halloween. Hence, Frankenspine, which also happens to be the name of this channel. And I think that's kind of badass. I'm incredibly lucky and grateful to have the support and resources that I do. Thank you, everyone. I know I'll be okay. My surgery date is, or now was, October 25th of 2024. If you have any questions, comments, anything, feel free to message, DM, or reach out. And I know that it's after my surgery now, but that still all applies. If you have anything to say or have any questions, I am always open to talk about it. Genuinely thank all of you for watching. I hope this can help somebody who is curious or who is going to have this surgery themselves. If you are in either of those positions, I suggest checking out some more videos on my channel where I talk a lot about my personal experience with this surgery. And like I said, don't hesitate to reach out. So, thank you guys so much.